Broadcasting live from the Business Radio X studios in Phoenix, Arizona, it's time for Phoenix Business Radio, spotlighting the city's best businesses and the people who lead them.
Good afternoon and welcome to Collaborative Connections radio show and podcast sponsored by KLM Consulting. We are coming to you live from Phoenix Business Radio X studios inside Max 6, and I cannot wait to jump in and talk to these three amazing people I have in the studio with me today. So I will jump right in. I'll go around the room. For those of you who don't know my voice, I am Kelly Lorenzen. I own KLM Consulting, and I created the show to bring business leaders, nonprofits, associations, and people together to collaborate and do good business and hopefully learn something. So our guests and listeners will hopefully walk away with a golden nugget. So anytime during the show, you guys have some wise words, jump in. But Heidi, I'll start with you. I would love to have you introduce yourself. Tell us a little bit about your business, your, who you're representing today, and we'll go from there.
Well, thank you so much for having me on this program. And I think this is such a great idea in this day and age of everyone being so busy and a lot of technology. To really have that personal touch and connecting is important for business and also to really help our community. So my background is in media. I have my own company, Swingo Media. And I was in television news for many, many years and talk radio and all of that. And then with age and with my family and people I love to age, I started really focusing on healthcare for that aging senior. And that's when I connected with Senior Living Connectors. And I am the spokesperson for this new platform, a coalition of really vetted out, trusted resources, not just to help that senior aging navigate the emotional and physical challenges that come with aging, but also the adult children, the partner, the friend, the relative, or the caregiver who has that responsibility. So Senior Living Connectors is a way to help you navigate that. And I'm really a senior advocate today. Hey, I'm 61 years old. I guess I'm a senior too. So that's my little elevator pitch and speech and why I'm here today. And really happy to be here because I think we have to really talk about this. Boomers are aging and we need help.
Absolutely. Thank you so much for being on. And by the end of our introductions, you'll figure out all the connections each other has right off the bat. Thank you, Heidi. All right. Next up, Breck, introduce yourself. Tell us a little bit about you and your business.
Yeah, I'd love to. And thanks for having me on. This is a fun experience, not only because of the radio broadcast, but because of the podcasts that are made from this as well. And that is so popular right now, right? Everybody's listening to podcasts. I probably have about 12 waiting for me right now on my phone to catch up with. And some of those are in our industry and some are just pure pleasure, right? So I'm a co-founder of a company called ServRx. We're also in healthcare. Started in healthcare about 20 years ago, working for a third-party payer, a company that was helping community pharmacies better serve their patients, specifically for workers' compensation. So there is a gap between the time that an injury happens before it's even on file with their payer or even sometimes their employer. And so this little third-party payer helped fill that gap, made sure that the injured worker could get their prescriptions today, not have to wait until tomorrow or the next day, but could take care of them today. And then it would also benefit the pharmacies dispensing the medication because they wondered how they were going to get paid for that. And so this was a company, it was called Third Party Solutions. Started a little over 20 years ago, and I helped develop their whole community pharmacy division. It ended up growing very rapidly, and just about every pharmacy in the nation used this service to bill for the workers' compensation claims. And then a big pharmacy benefit manager, a PBM, saw the opportunity to gather all of that information, all those first fills, and funnel them into their networks, so they could obviously make more money. So that company was bought, and there was a need for a new and improved third-party payer out there, and that's why we started ServRx. So ServRx is a local Phoenix-based company, but we work with pharmacies all over the United States. We have 16,000. We actually have over 20,000 under network, but not everyone needs to use workers' compensation as a third-party payer. So maybe they're in geriatrics, or maybe they're a pediatric pharmacy, and so there's not a need for. We don't have sweatshops here in the U.S., do we? No. Yeah. So pediatric pharmacy doesn't usually fit real well with workers' comp. But in those 20 years, we have uncovered a dirty little multi-billion-dollar secret, and I'm going to be excited to tell you guys about that here in a little
bit.
Good lead.
Cliffhanger. Give us a lead line.
I love it. Thank you so much for being on with us today. And Kimberly, tell us a little bit about you and your business.
Okay. My name is Kimberly Mitchell. My husband and I own and operate together a home care agency called Home with Health. So it's a non-medical agency, and we typically help seniors to stay independent at home. Not all of our clients are only seniors. Some of them are younger, recovering from some kinds of surgery or procedure or whatnot. We are a proud member of the Senior Living Connectors that Heidi's a spokesperson for. And yay, one of the vetted home care agencies through that membership. So I'm excited to be here. Thanks for having me.
It's exciting to have you on. So I'm Kelly Lorenzen. I own KLM. We're a business development firm here in Phoenix. And I brought all of you together because I am passionate about connecting entrepreneurs, connecting business leaders in the community to do business together, to do good business. So and funny how this world gets smaller and smaller the longer we're in Arizona, right? So Heidi and I got to work together a tiny little bit, family business, medical practice back in, I don't know, was that 2007 or 2008?
It was a long time ago. Yeah.
When I was a baby. So when her name came across my desk again, because Kimberly is a client of mine and said, hey, we're a part of the Senior Living Connectors, connect with Heidi. And she emailed me. I said, oh my gosh, I cannot wait to hang out with you again. What a small world. And then I was at a local first event because I love supporting, small business, clearly, and got to meet Breck, and he started talking about healthcare and all these new things. You left us with a cliffhanger that I'm so excited to hear. And I said, oh my gosh, you need to meet Heidi and Kimberly, and I am going to connect you guys on the show together. So that's the way it went down. So Heidi, for you, back to your Senior Living Connectors, the draw was, you see this need. We all need to start talking about this. You said, what does that mean? What is this?
Well, I think anybody who is listening right now, all of you in the room, we have a touch point with a senior who is struggling, facing a challenge. There was a recent series, quite a while ago, several years ago, that ABC did, called Seniors Living to 90. We're living longer, we're aging. As baby boomers, part of the sandwich generation, we're taking care of our kids, and you might be younger than a baby boomer age, and we're taking care of our parents. But more importantly, aging is complicated, and we've all had a personal experience. My mother, 8 years with dementia, a brilliant, amazing, academically off the charts, fab lady, and she declined, and it was very hard on the family. My sister, diagnosis to death 6 weeks at 72 with pancreatic cancer, stage 4. So you have these personal experiences, and you also watch families. Look at HR. There's a talent shortage around the country, and yet one of the main reasons people who are getting trained, talented, have to leave work is because they're taking care of a senior. And as I age and my family ages, what I'm seeing more and more of is the stress and the difficulty to just kind of navigate through. It's a story that we're not talking about. We're talking about the pandemic. We're talking about COVID-19, but the news person in me is saying, what about the real ripple effects after COVID for a care home? What about the caregivers? What about people in the senior industry, the vulnerable population? So to me, I really appreciate this kind of opportunity to tell real stories, because we all have a heart stake in it. And if you aren't going through something now, you will, whether it's somebody you love or it's yourself. And I feel like we're not aware of it. And we have got to become more aware and know the tools to kind of work with. It's sort of like whether it's a pharmaceutical world, or what's the difference between the different types of care. And Kimberly, I know that's an area you're in. I never really understood that until I had to go through it with my mother. Was it assisted living? Was it somebody coming in the home? What kind of support could we give her? Was it going to be a full-on dementia care facility and memory care unit? It was a whole education. People don't know it, don't get it until they're in it. And I think they need to do a little more preventative education out there.
We were just talking about that last night, weren't we, Kimberly, about people not understanding, ahead of time that there is this help, number one, that there is even availability of this help. Somebody said to you last night, what's a caregiver? What does that mean? Home care agency, right? And that was an aha to me, because I had already been through it with my grandma, and obviously you're a client. So I'm very, very well aware, but there are, like you said, Heidi, there are people out there that don't even know that that's a thing. So advocating for getting help for our family members is huge. Tell us a little bit about, for like back to the basics, right? What is a home care agency? What do the
Sure.
professional caregivers do?
Well, to your point at first that, people, they don't know what they don't know. And then until you're kind of thrown into a situation, usually very personal situation, and then you have to navigate and figure it out. And the thing that I love about the Senior Living Connectors is it's a place to help the senior to try to figure out if they need what we provide, which is home care on a non-medical basis, or placement, or a variety of the other, services that are out there. So I think the biggest sort of confusion and misconception is when somebody says home care, there's a lot of services that are provided in the home. So there's private duty, non-medical home care, which is what we do. So that's bathing, dressing, meal prep, light housekeeping, transportation, doctor's appointments, things of that nature. Then there's more of the home health, which is more the medical, physical therapy, occupational therapy, those kinds of wound cares, those kinds of things. Nowadays, of course, there's mobile everything, mobile dentist, mobile x-ray, and there's all kinds of things. And I think the home care and the home health are probably the two biggest confusion of what they are. And then, of course, who pays for them, or the difference of how they get paid for is
exactly
always a misconception.
And I think so many people think something either is not covered by insurance, not affordable. And that's where the whole insurance world, to me, is still confusing. And I know with my mom, to your point, Kimberly, we had somebody come just in the home for a while, non-medical, and we weren't really sure where to go, where to start. We had a recommendation. It was really tough to know what questions to ask, and was it covered? So how does that work?
So we have two parts of our business. So one is the private pay side, and one is the access or Altech side. So on the private pay side it is a cash, I say cash, but
Right.
Private pay by a family or friends or whatnot.
That's what we did. We did. And it actually was a lot more affordable than where our mother ended up going at the end of the day. And I always wondered, did she get any better care? It was, you kind of go back and forth with that. Finally, for memory care, she did, but she went to an interim place, and we really questioned ourselves. on
Sure.
those decisions,
Sure. I would say that we are more cost effective up to a certain point. And then if somebody is in the need of a 24/7 care,
Right.
the ones that money is not an issue, then that's not an issue. But for most of us, at some point, it's going to be less expensive to move to a group home or assisted living or, something of that nature.
And we
Right.
just talked about that too last night. Like, whoa, we better put away money.
Right.
Like I don't want to leave, move out of my house. I better. So I said in the line item in our financial plan, I'm like, is there a line item for caregiving at home, please?
Yeah, because the gentleman that was speaking, I'm not sure exactly how old he was, but I would guess somewhere in the around 50. And he was like, oh, I better, think about that for myself. And I was like, well, what I would suggest at this point is that you think about how you're going to pay for it, because it's definite. I mean, it's a high cost, depending on what the needs are, of course.
Yeah. And it's also
have,
interesting. Oh, I'm sorry.
no, that's okay.
I was just going to say, really what you're talking about is something we've talked about at Senior Living Connectors. And that is everybody has a retirement plan down to the T, when I'm going to pull the trigger, how much I need, all of that. No one has an aging plan. When I ask so many of my peers that, what's your aging plan? They say, oh, I've got my retirement plan. I said, no. What's your aging plan? And are you planning for these kinds of things that will occur? And I'm surprised when a lot of people say, well, I sure don't want to go to an assisted living facility. I'm going to stay home. Well, that's going to be an expense. Is that in your retirement plan? So to your point, it's kind of interesting how that plays out.
Talk about prevention and, and having the insurance and stuff. Tell us about the workers' comp side of things. I always think of workers' comp as something for somebody like my husband had a commercial electrical business. He needed to provide workers' comp, clearly. But is it a need for more than just people in the, like manual labor? And how do you guys serve them?
Yeah, that's a good question. So, workers' comp is one of those entitlement programs, right? It only exists here in the United States. Other parts of the world really don't have workers' compensation. And it's the trade-off that the injured party isn't going to sue their employer and accept the benefits through workers' comp. And so that's why employers have to carry work comp policy. A lot of them are self-insured, right? So it comes out of their own pocket. Or you could have a big carrier like Liberty Mutual, Travelers, Hartford, someone like that. That's the underwriter. Some people also use a policy that will allow them to cover up to a certain pain point, right? And they say, okay, I can handle up to 250,000 in-house. So that would be self-insured to that point. And then it would roll over to one of the big carriers for a catastrophic injury. And pre-COVID, there were quite a few injuries that actually has come down. I guess OSHA can put a shiny star up that, they're keeping the country safer. No, it's people are staying home. It has nothing to do with keeping the country safer. But the overall pharmacy cost, which then does the overlap with what we're talking about here in healthcare in general, that overall pharmacy cost depends on who the payer is, right? And it's like a lot of services. If you were to cash pay for something, let's say that you needed a procedure, a surgery or something like that. If you ask what the cash pay price is, it's going to be different than what they bill the insurances for. And so that was going to be my question to both of you in the senior living side of it. Is that also an option? If someone has put that money aside and they're able to just pay for facilities, pay for home care, and they're just going to pay out of cash and not use a insurance program, is there a difference in cost, or is it about the same?
Well, there is no insurance that pays for the non-medical home help or assisted living. Medicare pays for all of your medical needs,
yeah.
right? But not what we do, and then not in the group home or assisted living kind of setting, unfortunately.
Right.
Some people have long-term care insurance policies. Older ones are usually better. The ones nowadays, in my experience of what I know of them, are much more expensive and don't cover as much, is part of the problem. So, really either an access will cover, if you're on LTAX, that will cover for non-medical help. So either you need to be on one edge of the, spectrum or the other, either be qualifying for access to get help or have enough money to pay for it, because there's really nothing, no insurance or whatever kind of in the middle to help with those costs.
Yeah.
Isn't that so sad?
Yeah. I know a few years ago, I was well acquainted with a doctor who was a mobile physician and catered specifically to the senior population, the elderly population in assisted living homes, and did that through, Medicaid and all of that. But he said there was a trend in practices for cash offering a discount because of the navigation of insurance and all of the changes that have been taking place. Especially with dual insurances, if you have a supplemental insurance tied to Medicare, and that was a trend. This was a few years ago. I don't know if that's turning out to be true, that it was going to be more of a pay for service and a lower discounted fee, to your point or question earlier.
Do you know if some of the more strategic life policies, where they're more of a living policy rather than death benefits only, if you can pull money out of those to help pay for some of these home care services?
Yeah. So I think some of the newer long-term care plans that have I think their IUL maybe is one of the acronyms, but it's kind of an all-in-one. So there's the death benefit, and obviously occasionally somebody passes away, but there's also living, where you can take money out to pay for not just your, home aging kind of services, but, all kinds of things, buy a new car, whatever.
Survival.
Right. As opposed to the old long-term care insurances that most of my, 80, 90-year-old seniors have. It's when they pass away, that if they didn't use it all, it's gone. And there's, they can only get so much per day or per week or whatever their policy happened. There's more restrictions on what they've got.
Mm-hmm.
Yeah, it's nice now to have, like mine, you can take out money for whatever you need, and borrow against it. And I mean, I don't even think that's the right word, but use it and not have to pay yourself back, I think.
Yeah.
But that's a whole nother topic. All right, Breck, you left us hanging. So come on, tell us what's new at ServRx besides the workers' comp.
Yeah. So, our focus has been work comp, and when the first third-party payer was acquired, the grandfather of our industry, it left a hole, and that was the whole reason we started ServRx, was to fill that hole. But the new owner, I had a non-compete, right? So I had to be very cautious about what I did in the marketplace. But the new owner was a big PBM. There's 3 PBMs, pharmacy benefit managers. That's PBM acronym is. So they're one of the 3 big, and 3 of them manage 80% of the lives nationwide. So there's an issue there. It's a whole nother segment. But one of those bought this third-party biller. And even though I had a non-compete, they also filed a temporary restraining order. I got slapped with a TRO because they didn't want me to go out and tell the pharmacy industry. I sat down with every major pharmacy chain and independent pharmacy group in the nation on a quarterly basis to do their business reviews. They did not want me going out telling them this dirty little secret.
Oh my gosh.
So I had to live out this whole TRO to not tell, the truth of what's going on. But literally the reimbursements that they were used to getting as a reimbursement for managing and taking care of the pharmacy needs of an injured worker, went from, the average $50 or $60 per script price to $4 or less. And the reason being is that the PBM wanted to put that extra money in their own pocket. Imagine this: you're a pharmacy owner, Bash's, right here in town. They're a partner of ours. Great company. They have all these grocery stores all over the state, in rural areas, and right here in Metro. They own their own pharmacies too. So there's pharmacies in about 42 of their locations. So in the old system, which they're still under the thumb right now for another year, they would have an employee at the warehouse. Let's say an employee's moving a box of apples and he strains his back. And so he goes to the doctor gives him a prescription. Maybe it's a muscle relaxant and some pain medicine to take care of the issue. So that employee then, that Bash's employee, goes to the Bash's pharmacy, and Bash's dispenses their Bash's paid for medication to their Bash's employee. And then they process it through a PBM. That PBM pays them $4 for that prescription.
Oh my gosh.
It's their own drug that they dispensed. They get $4 back on that. And then corporate gets a bill for $95 for that same prescription.
No way.
So it's basically selling your own drug to the PBM for $4 and buying it back for $95. And why would you do that? But that's how every program is set up. In fact, there's gag clauses in the pharmacy contracts. So if you're a network pharmacy, you've got to honor your contracts. They'll kick you out of network. That's how much control they have. They'll kick you out of network, and you can't even process for all of the healthcare claims. And, workers' comp is only maybe 1% of all the scripts. So you need all those United healthcare patients. You need all those Aetna and Blue Cross Blue Shield. You need those to be open as a pharmacy. But yet you'll have a gag clause in there that says you cannot tell the patient their cash price for the medication until—
Is that legal?
Clearly not.
Not anymore.
Sound like it.
So with the help of us shining light on this, with the National Community Pharmacist Association, 200,000 pharmacists nationwide are now starting to get legislation passed, but not until recently. I mean, it's literally been within the last 2 years that they're starting to pass legislation to remove those gag clauses. And there's DIR fees. What is a DIR? I have no idea, but the PBM can literally claw back reimbursements. I think it's when they get to the end of the quarter, they look and see, have we made the profit margin that we, one PBM, I don't want to mention any names, but their initials are Optum RX. They only made $136 billion last year in a downturn economy, 136 billion with a B. And that's just the PBM. That's not even the life insurance part or the healthcare side of the business. There's really a broken system right now, and it's the middlemen. One of the largest chains in the nation, largest pharmacy chain in the nation, they have over 10,000 locations. They sell everything from prescription medication to toilet paper and Twizzlers. They sell it all. 80% of their profit margin comes from one little PBM in Scottsdale, Arizona. 80% of the profit of a 10,000 store location. There's a broken system. We can fix it. You just got to take the hands of those middlemen out of the pot. So when the contract runs through for Bash's, we can now go in and say it's a straight pass through. You tell us what the cost of the medication is. That's what we'll process the claim for.
Oh my gosh. Good job. Good for you. So how is it going to happen now? So, from now on.
Well, some of these people I've named will probably have me offed now, but because it's billions of dollars, right? Honestly, they have a lot of clout and power. and they're spending millions of dollars with legislation and with advocates that are going in there telling all the reasons why they need to be in the mix. Another Arizona example, up until this past year, a physician who was treating workers' compensation patients that have a hard time even getting to the provider. So example would be anesthesiology pain practice that is doing spine blocks on patients that have severe, pain. And so they're literally going in and doing spine blocks. Well, then they, prescribe a anti-inflammatory or something else. But it's so miserable for that patient to then go from their doctor's office, then over to the pharmacy, wait a couple of hours for the prescription to be filled. The state allowed that there be these little point of care pharmacies. So the doctor's office could have a small little locked cabinet behind a locked door that would have some of these medications that are needed for some of these. A practice that happened actually before there was a retail brick and mortar pharmacy, Little House on the Prairie doctor, right? He brought his bag and he had the pharmacy right in his bag. So that's been going on since the very beginning of time. The PBMs legislated that out of the state of Arizona. So a doctor cannot even take care of that patient anymore because it was bypassing their networks. They want it all to go through their network so they can make their $90 here and another $90 there.
Yeah.
Oh, man.
I think the other piece that is really coming to light, and a very interesting story that you just shared, is as you look at the world of medicine as a whole, I know that everybody is a specialist, or is this the right way? And a lot of times when you navigate the care process, it can be confusing, it can be difficult. One of the things that I've learned is when you go through this kind of process, whether it's a pharmaceutical issue, which is getting mixed meds, wrong meds, I can't afford the meds. We know that story. Pain is big in America, but also how you navigate the system. Had I known there was something called a patient advocate or somebody who had the smarts, even your knowledge you're talking about in the pharmaceutical world, no idea. Education, awareness, and I go back to some of the people I know in the legal arena, for example, at Senior Living Connectors, or in the medical realm, that patient advocate who can help you navigate the system and say, hey, wait, heads up, there's an issue here. So yes, you definitely have to expose any corruption that's out there. And there's a lot of it all over the world, all over the planet. And how do you, and I go back to prevention, and stay proactive in your journey in that medical arena, whatever piece and part that you're exposed to or that you get involved in. And I think the more people get educated, the more change will be affected ultimately in the end for whatever area of industry you're in. So I know, for example, whether it's the fiduciary, elderly law attorney that's more than trust in estates making the big decision, or it's your medical plan of care and that one specialist. How many times have you heard the left hand doesn't know what the right hand's doing? With my sister, we couldn't get a diagnosis and she was dying and she was in pain. So we just didn't know how to handle it. And we were, desperately rattling cages to get to the right oncologist who was out of town, who had this. Then this person couldn't give the diagnosis. Were we not being told the truth, or were we not educated enough to say, enough, I need this answer? So whatever battleground you're fighting, I think the best defense is to really be educated and to share this kind of information so that we can understand, wait a minute, this is what's happening when I pay for this. That's how I think you really go to the next level. I mean, people have powerful lobbyists. We know Big Pharma has a lot of power. A lot of different medical groups do. A lot of companies do. Tech giants, all of that. How do we as a community not stay passive, but become proactive in a positive way to help educate and mitigate some of this stuff in the future, right? I think that's really, really important, having platforms to do that. I mean, I'm really amazed at how clueless I know I am about how the medical world works. And I've been in healthcare. I know a lot of people in town. I've worked with a lot of healthcare companies. I still feel naive. How do we change that for people who have no exposure and are just automatically saying, okay, I guess I do this. I guess I do this, you know?
Having these conversations, having the spokespeople to actually say and be okay saying they may come after me, but I'm going to say it anyways. Have the whistleblowers, you know, that I just heard about from a PR summit I just went to, you know, from the VA doing a lot of not good stuff, you know, and Facebook and whatever. We need these advocates. We need these people to tell the stories of this is what's right. Right. I just did a quote today. There's no right way to do the wrong thing in business. Right. There's just not.
Correct.
And so if we can all surround ourselves with each other and start talking about it. Same with you, Kimberly. I know there's not a lot of oversight for the home care industry. Can you tell us about that?
No, there's very little oversight. If you're just a private duty home care agency, there's nobody checking anything at all whatsoever. We do have a local association here. The acronym is ASNAHA. We have a national association that's HCAOA. So they're basically home care associations for Arizona and for the nation. Being a member of those, they do have requirements of certain insurances and workers, compensation being one of them. All the employees have to be W-2 employees so that they will have all of those coverages. So, you'll hear the stories of a caregiver falling in a client's home and them going after their homeowner's insurance because they don't have any, liability insurance or any of that, that kind of stuff. So with the associations, we have the W-2 requirement, and they check that you have insurance. They don't really check the level, or we don't have a minimum, I guess I should say.
I was going to ask that question. There should be some kind of a standard of coverage, right?
There should be. So the only real oversight are agencies that are also contracted through Access and Altex, because those insurance companies contracted with them, they do require certain levels of insurance. And then they're checking what everybody should automatically be doing, like background checks, APS checks, making sure everybody has CPR training, all the things that everybody would just assume that the caregiver has gone through when they go to your home. But there's nobody checking unless it's one of the insurances through the state.
Isn't that crazy? And when she told me that,
there's no licensure, right, for non-medical home care, right? I know.
When she told me that, because I was like, I do all of Kimberly's marketing. I was like, what are all these, symbols and what are all these things on your website? And she's like, oh, we're a member of HCOA and ASNAHA, and we, contract with Altex and all these things. And I'm like, that's so incredible. Why? And they're like, because they're at least, keeping us accountable and holding us to a higher standard than, looking it up. But I wouldn't have known that, I didn't know that when we hired somebody for my grandma. I don't think the general population knows to even think about asking those questions when they're interviewing home care agencies, or when they're going to a pharmacy, or or the patient advocate, like you talked about, Heidi. I just don't think that people are talking about it and telling those stories.
Are there HIPAA compliant policies that you have to follow in being a non-medical provider? Do you still have to be, keep patients' rights and information protected?
Yeah. I mean, we're not really given a lot of medical history and whatnot necessarily.
Right.
So I think like our software and all of that, from a security, standpoint and whatnot. And then, obviously the paperwork and whatnot that we have caregivers sign that, whatever information that they learn while they are helping X family, that, that's not something that gets shared. For the most part, we're only doing that non-medical and don't have that. Now, if we get a referral from like a rehab facility that they're, on their way home after whatever their procedure and whatnot was, we will be given some of the medical understanding so that we can work with the home health that's going to come in and do physical therapy. And, we can all kind of be proactive, which is, kind of the theme of the conversation. But since there's not really licensure for non-medical, I mean, no one's, we're doing the right thing because I'm a big believer in karma, but there's not really somebody like checking that I am,
Well, and unfortunately, there's a lot of mediocre among great people like you that have a conscience, Kimberly, all of you that are saying, okay, let's really keep a standard of care. But unfortunately in Arizona, like a lot of other places, when it comes down to regulation, a lot of people are offering services and they really aren't vetted out and qualified. And that's why these associations, like, is it Ozraha you were talking about? I know Scott Fisher, the co-founder of Senior Living Connectors, has passers for, home placement, how to raise that standard. And as you were talking about asking the right questions and knowing the right questions to ask, the other really pervasive thing in the room, the elephant in the room that no one wants to acknowledge, is what's been termed the silver tsunami. Have you heard that? Oh, yeah. It is the baby boomer population, the largest population, 1948 to 1964, is now getting really old. So, and they're living longer, and they are a silver tsunami, but they don't have the savings their parents did. Assisted living with the spike in dementia and Alzheimer's, $6,500 a month is something that's very difficult for an average aging person to cover. Insurance, savings, boomers are a whole different type of generation. The vet population and everything that's happened there, where we are as a country with mental health. And let's not forget that word addiction. And we're talking about medical addiction to drugs and everything that's happened. So I feel the elephant in the room is this silver tsunami, and how are we really going to handle it? Because right now it's the tip of the iceberg. And if we are indeed living longer with less quality of life and less resources, we're going to have to come up with new models, new platforms, better education, because it affects everyone. The impact on a family. We always talk about the kid moving back home, but the double dip, it's mom and dad, and it's our kids, and it's ourselves aging. How do we navigate and handle this? And it usually takes a team to help you get through it. It's not just one person. And the other thing that's happening, and I'm sure, Kimberly, you're experiencing this, and maybe you all are, and that is the talent pool shortage. I've heard that finding caregivers is a tough ask right now. And again, every industry, from restaurants to media to tech companies, everybody's having issues. But when you are caring for someone, we really underestimate the job of the caregiver. It's kind of like teachers in this country, I think. I think we really, we have to be careful not to undervalue these people who are helping others. So I don't know if that, rings or resonates with all of you, but I feel like this is why we have to have more of these, not just conversations, but really raising consciousness, because we are going to have, excuse me, I didn't turn my phone off, I'm back. We're going to have these issues, and they are going to impact society in a much larger way. It's already happening. So I think that's the other piece of this whole silver tsunami, and seniors, and why they are so critical. just as much as our future generation and all of us in between. And it's a big impact. So I would just be interested to hear your thoughts and feedback on all of that.
You know, you certainly touched a nerve with us with there not being enough care providers, not enough workers, not enough people to reopen the dining rooms of McDonald's, for goodness sakes. You know, it's really a sad situation right now, and so easy to blame it on the pandemic. But you know, if you're going to pay somebody double what they would have made on unemployment than just 2 years ago, it's hard to get that quality of people to want to come back. I even heard of yesterday, people, you can actually go out and look on some kind of website to see that Amazon is short on drivers, and you can pick up a route and just in your own personal car go pick up a couple of packages and deliver them. How safe is that now? Yeah. But anyway, it's a nerve for us because we process workers' comp claims. We need people to go back to work. So, you know, it's a little bit kind of the double-edged sword, right? That people have to get hurt for us to even process a claim. But we just need the economy to get back on track, and we need people to go back to work. We need businesses to reopen. We need restaurants to be open, and we need the economy to just get revitalized again.
Absolutely. And tell us your new thing to be able to help that, I think.
Yeah, we haven't even touched on that, have we? This is a community service that we provide to any business. For us to provide the medical staff, we would need groups of 40 to 50 employees, but we do free COVID testing. So that's one of our community services is a free PCR COVID test. You know, it does take 2 or 3 days to get those results back, but we augment that with some rapid tests so that if an employee is saying, hey, I've got a scratchy throat, I just don't feel right, and their PCR test hasn't come back from the lab yet, just pull out a rapid test, quickly do a swab, and within 5-6 minutes, you have the results. That way you can cut down on your lost time, which is really expensive to employers. But yeah, we would provide that as a community service, totally free. It doesn't cost the employer anything or the employee. And we just want to try to help people reopen.
Isn't that a cool program?
That's really awesome. And kind of building on the positive vibe of that. I know that's why Senior Living Connectors was created, to really help people find solutions with quality providers and healthcare workers. So oftentimes you don't really know what you need until you can call someone and get an idea. So we have a clinician, and again, this is free of charge. You can really get guided in the right direction. It doesn't cost anything. And we have a clinician with a background in healthcare to really say, okay, Mary, you've got a parent who's really struggling. You need to look at home options. I'm going to connect you with this person. Or you've just moved your, parent from another state. You need to check insurance the way Medicare works here. You need a power of attorney, all these things you might not think of. So what are little positive things we can do to up the game, up the standard, and provide it for free? So I think it's wonderful that you're doing the COVID testing for free. That's great. I know that's what we're doing. We're sharing resources and information and education so you can custom fit your needs and what your insurance is, or what it isn't, through this platform, Senior Living Connectors. So I think that's another positive thing that doesn't cost anything.
Yeah, that's awesome.
Free information. Yeah.
Knowledge is power.
Knowledge is power. Exactly.
And what was the minimum of the code for COVID?
We'll help any company, but if it's less than 40 or 50 employees, we'll send you to one of our participating pharmacy partners, and then they'll do it for you. But for us to come to your place of work, your business, it needs to be 40 or 50, because we'll send out a nurse or a medical provider to do the collection. But if you're a company of 10 people, we'll just send you to one of our closest pharmacies and have them do the swab there.
Such a nice ad for people because, Kimberly, I know you guys with 130 employees and trying to always find caregivers, you're like always struggling with, okay, what do we do? What's coming? How do we keep these people? How do we find new people?
And something that might help you too, Kimberly. I don't know. We promoted this to the restaurant industry, right? So that we can kind of build consumer confidence, go back to your local restaurants. Is that we printed up these little stickers that say, I've been tested, I'm COVID free. And they just wear the little sticker if they're a server. And so if that's something that would be beneficial to you, I don't know if any of your patrons are like, is this person safe coming in here? But yeah, we'd be happy to help with whatever we could to make sure that your customers feel comfortable with your staff coming in.
Sure. Yeah. For the most part, being in the private homes, I mean, we don't have the 150 caregivers all in one spot.
Right.
They're all around Maricopa County, and clients and caregivers the same. I would say that probably a lot are vaccinated already. So there's, not a huge, but I was just thinking in my head when I was asking of how many for more of like one of the larger assisted living places. I wondered if you're trying to get into some of those kind of communities that have that amount of employees in one place.
Yeah, it's a service that we're providing, and so we gladly take it anywhere. I even reached out to my son's own school district and said, hey, let me help you with this because they're going back to school, and this was several months ago, of course, and it just never got going. And I wondered why. I'm going to offer it for free. And I'm kind of selfishly wanting my son to be protected. And sure enough, he gets COVID and it wasn't bad. It's not bad on at least his age group, or at least he handled it really well. But for the most part, it was fairly mild. It just kicked him out of school for a week. He's in AP classes. That put him so far behind. And so I call up the person that handles all of the nurses for the district. And I'm like, now I'm really upset. We could have put this in place, and now my son's home. And come to find out that it was somebody high up that she reports to, that his friend was going to put this program in place, and it just never happened. So that, politics is in everything, right? And even when you're trying to help somebody and give them something free, but it's a community service that we will provide to whoever needs it. And if I'm not an advocate for overreaching government policies, but if OSHA does pass the president's mandate and employers with 100 employees or more either have to be fully vaccinated, and we all know the political nonsense going on with that and all the canceled flights with Southwest, and that personally affected me. But if they don't have the vaccine fully vaccinated, they need to do a weekly testing protocol. Now's the time to put that in place, not when it becomes, and again, I hope it doesn't. I think it's an overreach, and that's my own political statement there, that government shouldn't have that much control. But if OSHA does follow the president's mandate, and you need to either have full vaccination or a testing protocol, put that in place now. Don't wait until it becomes a mandate, because everyone will be backlogged and you may not be able to be compliant.
Yeah. Speaking of community and doing things for the greater good, Heidi, I know you're involved with quite a bit of things, and I know Breck, you are, and Kimberly. So I'd love to hear from each of you, two of your passions at the moment in the community.
I really am really so about supporting seniors, and I believe in Generation Next. So I'm a true sandwicher. So I really like working with senior living connectors because I feel it fulfills that need. And watching my mother and my sister die within a year of one another really changed me and changed my life. And so I do that through senior living connectors, but I also work with the Honor Health Foundation and do a lot of grant videos. So I do video marketing and really really believe in their cause at Desert Mission. Desert Mission is a food bank. They also help families with new children. They provide supplies and foods through donations. They have an adult daycare center that is just phenomenal. My mother went there, and it's a place for somebody with dementia to go and have engaging activities. And they have a preschool called the Lincoln Learning Center. And for those families who need to get their child kindergarten ready, who come from that lower socioeconomic level, it's a great opportunity for a child to get a fresh start and a good shot at a good education. So I would say right now at this stage in my life, anything I can do to help serve seniors and give young people the confidence to move past anxiety and succeed, that really is why I feel I'm here on the planet today. Not to say that I don't have fun and love doing video projects and all of that, but those are my two, I would say, points of passion and trying to give back to the community.
Isn't that nice when you're an entrepreneur and you own your own company? You can do all those things.
Yeah, absolutely. Absolutely.
That's the best. All right, Breck, what about you? Community I mean, obviously that's a huge one.
Yeah. So other than education, right? Let's educate everyone about this dirty little multi-billion-dollar secret in healthcare. And it's not just on the pharmacy side too. It's also, obviously in the medical and the procedures side of things as well, and physical therapy, all of that. There's middlemen involved. But I'm all about community pharmacies, and not just in our own community, but all over the nation. These community pharmacies provide such a valuable service. That's why we're part of the National Community Pharmacists Association, even though we're not pharmacists. But we want to support those independents. There's still about 20,000, 22,000 of them nationwide, and you'll see the big chains buy up 300 or 400 of them, but then you'll see new ones reopen again. So it kind of ebbs and flows around that 22,000. So we're passionate about helping them stay in business and serve the communities that they're in. We're passionate about local first. We're part of Local First Arizona. We want to reestablish the economy right here in our own backyard. And that's why, we're offering the free COVID testing just as a community service. We just want to help businesses get back on their feet and reopen again.
That's like so nice. See why I love having all you here. Kimberly, what about you? You are involved in so many things. Give us a few.
I should start. Well, professionally, I would say events probably at communities and assisted livings and things like that, mostly just for somewhat connecting, but I mean, for myself, for knowledge. And I mean, I always learn something new every time that we sponsor any one of those kinds of events for seniors in particular. From business in general, I'm a member of NABO and Athena Valley of the Sun. So particularly helping other women business owners, because I think us lifting each other up is very, very important in this day and age. I've been a CASA for the last 3 years. It's a court-appointed special advocate for foster kids. Part of the Athena Valley of the Sun, they're going to start a mentor program for high school girls. I have 2 daughters, one of which just started high school. So that's a very personal community project. And we just recently joined, okay, I'm going to mess this up, 100 businesses that care. Right. Okay. I didn't totally mess it up. So the general idea with that is multiple businesses getting together to give to local charities. So we're a member of Local First too. I forgot about that part.
Yep.
Yeah. So many cool things. That's why we're all connected. I love Local First. Kimberly and I first met at Girls Rule Foundation, helping
another one.
talk about prevention, right? Let's early education and prevent all these things. Talk about it, join these, help these nonprofits, join the community to be able to help the nonprofits. So I am very thankful for all of your contributions and your hour. Can you believe it's been an hour already today?
Wow.
Goes by so fast. And Karen just snuck in the studio, so we get to see her afterwards. Karen owns Phoenix Business Radio X and started 100 Businesses That Care that Kimberly was just talking about. And I cannot wait to do that with you guys. But thank you all for joining us today. Really, really beneficial, I hope, for the listeners and guests alike. And you've been listening to the Collaborative Connections radio show and podcast sponsored by KLM Consulting. Get things done by outsourcing what you don't love with KLM. Until next time, happy connecting.